Also, scooch, make sure you are close enough. Yep, good.
Hi, my name is Anna. I'm going to be your nurse today. How are you doing?
Good.
Good. Okay, I'm going to start by providing privacy and comfort. I'm going to do hand hygiene. Today I'm going to be doing a cardiac and peripheral vascular assessment on you. I'm just going to look at your wristband. Can you confirm with me your name and date of birth?
Sherry, 731.
Great. Okay, so I'm going to start by asking you a few questions. Can you tell me where we are today?
The hospital.
Yes, and why are we here?
For an assessment.
Okay, and what month is it?
February.
Great. Patient is ANO times 4. She knows person, place, time, and situation. Do you have any allergies I need to be made aware of?
None.
No? Okay. And are you in any pain on a scale from 0 to 10, 10 being the worst?
0.
Okay, great. Okay, so patient has good hygiene, is well dressed, she has good posture. Do you have any trouble getting around at home?
No.
No? So no mobility issues to note. So I can go ahead and begin my assessment. I'm just going to start by inspecting the chest region. Normally I would have the patient exposing the chest, but providing as much privacy as possible. I just would want to get better visualization of the landmarks that I'm going to be listening and palpating for, but for the purpose of this video, I'm going to keep her clothed. But I would be looking to go from sternal notch to the second intercostal space. This is the aortic landmark where you would hear S1. I would go over to the other left side. This would be pulmonic landmark where you would hear S2. At intercostal space 3, you would hear the Erb's point. At spot 4, you would hear tricuspid, and then if you go mid-clavicular line down, you would feel the mitral point. This is also where you would feel the PMI, point of maximal impulse, and where you would hear the alveolar pulse, which you would listen for 60 seconds. So now that I have inspected and palpated, I am now going to auscultate. And while I'm here, I'm also going to listen for the 60 seconds. For the purpose of this video, I'm not going to listen for the full 60 seconds, but in a real situation you would. I'm also going to listen for any murmurs with the bell portion of my stethoscope. Great. I did not hear any murmurs or anything abnormal. So now I'm going to move on to assessing your carotid artery. So I'm just going to start by inspecting skin. Integrity is good, color's even throughout, there's good symmetry. There's also good symmetry with your chest too. Hair just on herb is even throughout. I do not see any vein distension, which would be an abnormal finding. I'm now going to palpate one side at a time. And I would rate your pulse at about a 2. On this side as well, which would be an expected finding. You would rate from 0 to 4, and 2 would be 0 being you don't feel anything at all. 4 would be it's so fast you almost can't feel anything at all either. So 2 would be a good place to be feeling it. So now I'm going to auscultate with the bell side of my stethoscope. I'm listening for any bruit, which would be an abnormal sound to be hearing. It could be an indication of an occlusion of the artery. I don't hear any bruit, so that is good. I'm going to move on to your upper extremities. I'm just noting your skin integrity, symmetry, your colors even throughout, hair distribution is normal. I don't see any superficial veins, anything like that. So now I'm going to feel your brachial arteries on both sides at the same time. I want to make sure they're the same on both sides. Great, I breathe that a 2 as well. I'm also going to feel your radial pulse. And I would also rate that a 2. So that would be good. So now I'm going to feel for temperature on the skin with my dorsal side of my hands. And the patient is warm, which is good. I feel for edema. While I'm feeling for edema, I'm also feeling for moisture as well, which I'm not feeling any moisture or edema. Just kind of have you put your hands like this. I'm looking for capillary refill in the fingers. Fingers are evenly colored. pink towards the base and white towards the tips. And capillary refill is less than 2 to 3 seconds, which is normal, so that's good. So now I'm going to move down to your lower extremities. I'm going to feel for edema and moisture again. So I'm going down. I'm going to feel for temperature. And you're having sensation when I'm feeling your, okay, good. I'll make sure your patient has good sensation. Patient is warm as she should be, okay? Skin integrity is good. There's normal hair distribution, normal color throughout, good symmetry. I'm gonna feel for capillary refill on the toes. Patient does have nail polish, but I'm still able to see capillary refill and the pink color underneath, which is good. I'm gonna feel for the posterior tibial pulse. I'd rate that a 2. I'm going to feel for the dorsal pedialis point pulse, and that is also a 2. So I'm now finished with my assessment. I will document my findings.